Good evening. In the current times of coronavirus pandemic, the world has realized the importance of doctors more than ever. To celebrate this spirit, July 1st is celebrated as National Doctors' Day in India. As the name suggests, the day marks and honor doctors and physicians for their round-the-clock service. National Doctors' Day is different from one celebrated in the US, marked on March 30th. However, both days express gratitude towards the medical professionals who treat the health of the patients above theirs. In India, the National Doctors' Day is celebrated on July 1st each year to honor the birth and death anniversary of Dr. Bidhan Chandra Roy. He was a great physician and also the second Chief Minister of West Bengal. Ladies and gentlemen, it's my pleasure to welcome Dr. Amit Wanchoo to our e-discussion session on doctors, pandemic, and Kashmir. As you know, Kashmir Journal is an independent socio-political peace-building research exploring the scope of a possible resolution to the decades-old Kashmir crisis. Trained as a medical doctor, Amit Wanchoo is the managing director of Eaton Laboratories, the first pharmaceutical manufacturing unit of Kashmir, actively involved in low-cost healthcare. He had various fellowships, including the prominent Yale World Fellowship and Asia Global Fellowship. Welcome to the show, sir. To
Thank you,
begin with,
Irfan, and
yes, to
good
begin with,
evening to you.
thank you, sir. To begin with, doctor, sir, as a medical practitioner, how do you see the relevance of this profession, especially with respect to this pandemic context?
Well, Irfan, first of all, I would like to say Happy Doctors' Day to all doctors and even paramedics, because without them, we cannot do any work and any delivery. And also to people all across that this is a special day, not only for us, but for the whole humanity. Well, before I come to pandemic, I think medical profession is in itself a journey. Pandemic has just come right now, and we have seen pandemics before this as well, and epidemics as well. So I would like to share a small story of mine, like from where, because medical profession definitely changes the way you think once you are actively into it. Like I'm talking for most of the doctors, we do have some people who go onto a different path, but majority of the doctors I'm talking about. So when I finished my graduation, and then we have to do a residency. The residency is basically done like you have to pick up a chit and then you are sent to that ward. So when I picked the chit, it was radiation oncology. For those who don't understand it, it's kind of a, because cancer ward, in cancer we have surgical part, we have the medical part, and then we have the radiation part wherein you give therapies and other things. So my friend who was with me told me, come on, leave this chit, pick some another, because you'll be bored in this ward. This is something wherein you are going to see only deaths, and why you want to do that? But somehow I always believe that what destiny has for you, you should always take that path, because there is a learning in that. And I just went into that mode and picked up that posting. My first day in radiation oncology, Irfan, was such that you are seeing sick patients who mostly have lost hope in
Yeah.
themselves. And my first night was three very sick patients. One was a very old lady, second was a middle-aged adult, and then there was this 8-year-old young boy. And telling you honestly, all these three were from different, you can say, backgrounds. Like it was a middle class background, a very poor background, and a very rich background. So on night I was trying my best to save these lives, because my HOD also told me that we may lose them this night because they're really very bad. And when I was trying my best, slowly first we lost the lady, then we lost this sweet little young boy whose face is still in front of my eyes, and then we lost this adult. Telling you honestly, I was devastated till morning. I was thinking that three lives on first night, like you just are not able to answer yourself. And it was very, very bad for me that time. But then slowly it also taught me a lesson. And I will tell you that after that, like initially as a doctor, you also want to have the best of the whole house, the best of the cars and everything in your life. It slowly detached me from this materialistic life. And I could see that whether rich or poor, it doesn't matter. And what you gain in life is finally the goodwill of a person. And I remember all those three still praying for me when I was trying my best to save them. And after that, in that ward, I have learned so many things. Like, it was a life learning lesson for me, even right from people where parent is suffering from a end stage cancer disease or has an issue wherein his whole body is kind of stinking, and how his children leave him, how everyone who is caring for him leaves him. And it is a shock to that old man also, like, who has done everything for his family, and then when he needs them, all of them leave them. So this is what medical profession teaches you. Medical profession teaches you this lesson of humanity, and if we learn in life, I think nothing big than that. Now
Exactly.
coming to pandemic. So definitely, if you remember when we first heard about this COVID, when it was in China, and especially from January we started observing it. So I think in Kerala it was last week of Jan when we had that
Yeah.
first case.
First case. Yeah.
Yeah. So it was for doctors, you can say that they were someone going in front of a disease about which you have no knowledge. You don't know what's going to be the after effect. You don't even know exactly the precautions except whatever you have just seen in the news, or maybe whatever Chinese had done by that time. So just imagine, here we are telling everyone to stay at home, don't venture out, and people, even if they know that there is something happening in next locality, they don't even cross that road. And here
Exactly.
a doctor is going into the den of that, where exactly you have people, like, you don't know what you're going to do to your own self. And then in addition to that, you also have to think that doctors are also humans. If you remember, in the initial phases we all had so many problems, like pp kits were not there, the gears were not there, then the protocol was not there, even you were not knowing how to segregate these patients, what has been the protocol there. So lots of lacunae, like, so you were fighting an enemy wherein this enemy was virus without having anything in your hand, and then
Yeah.
you are venturing out. So there is a chance to have this casualty. And I salute doctors as well as paramedics who basically took this initiative, joined it. And then I think this pandemic also, we have to understand, gave them a lot of stress. If you remember, like, a psychological stress, as usual, even many friends of mine who would not sleep during night because this corona and covid is going on in your mind. You're not going to visit your families, you're not seeing your children, you're not seeing your parents. So it all summed up. And then the worst thing that I feel that hurted us as doctors a lot, one was that in Tamil Nadu, when you remember that doctor who was not even given a decent burial, and
Yeah.
how, like, these things basically get
It hurts.
you
Yeah.
into that thought process, yeah, that you are right now here, safeguarding for others, trying your best to save patients as much as you can, and then if something happens to you, you are not going to get a decent burial as well. So this then plays in our mind also in doctors. And even if you remember in Delhi or in other parts, when there were attacks on healthcare workers, then there were also, like, complaints that you don't have to live in this particular society because you're going to this hospital, you're going to that hospital. So in the initial months, definitely in Feb, March, even April, these stresses also added a lot on the doctors.
Exactly.
Then you will see, like, lots of people had complaints that why senior doctors were not coming, why they were on phone also. I would like to tell all of them that they have to understand doctors also have health issues. A doctor can have hypertension, a doctor can have diabetes, a doctor can have some any comorbid, that in comorbidities in this COVID, we have to be very careful. So I think that in this pandemic, we will definitely be on the front line and save patients and fight for all of our whole humanity. But we also need support from
Exactly.
humanity, and that support has to be in all terms. Like, I will tell you, when I got one of the emails from Ahmedabad, I think, and also from Madhya Pradesh, when doctors were infected and randomly around 10 to 11 were positive, and they were not provided a bed in the hospital itself
Oh.
for quarantine purposes. So you can imagine the state. what others will take from that,
exactly,
because our resident doctors have been on front, and then they have been delivering whatever best possible ways they have. So whether it is in private healthcare or whether it is in government healthcare, everyone is trying their best, whatever they have, right? Like I can say right now, definitely we are better placed in terms of at least having these safety gears or these PPE
exactly.
kits, or now the rosters are there. Imagine we were giving 24-hour duty. You cannot wear a PPE kit, Irfan. After 6 hours, you bloody get
Yes, yes.
suffocated, and you know how hot it is across. And then a person is wearing it for 24 hours. So at least now we have also had at least some, you can say, relief, wherein you have this 8-hour roster or 10-hour roster, but still at many places it's still 24 hours.
Yeah,
So
that's
I think,
why society calls you people heroes, the warriors of today. And
no, no,
I salute
definitely.
you
Thank you
here.
for that.
Yes, sir.
Yeah, and I definitely admire the whole community for that. But the only thing is that just give doctors a little bit of emotional support. And I'm not saying that every doctor is doing everything good. There are, like you have in every community and every sector, I think there are some percentage of people who definitely misuse the situations. I'm not
Yes,
saying
yes.
like we all are good, but majority are trying their best.
All right. So, as all of us are aware, the nationwide lockdown issued due to corona outbreak has affected Kashmir deeply. That too, not similar with any other parts of the country. Lockdowns and blackouts are nothing new in the restive Kashmir Valley. In the 12 years from 2008, Kashmir has witnessed five major political agitations, which include months long lockdowns, economic losses, and communication blackouts. However, without the 4G high speed internet and limited health infrastructure, it was tough for people in the valley to fight COVID. Doctor, can we have a brief analysis of COVID in Kashmir, or how pandemic took over in Kashmir Valley?
Yeah, like before I come to pandemic directly, I would like to say that since you already mentioned that we had a lockdown already in place for 8 to 9 months, and it was also very hard for all of us, whether it is business houses, whether it is people who are working or students, everyone. So already you had that mental fatigue also. No doubt we have seen lots of lockdowns, and we are resilient, but obviously we're humans as well. Like how many times you will try to come up and then get down, then come up and then get down. So if you see the whole transition in last 10 years, like for business houses it has been such a difficult thing, or even for people who have to survive in life, in private sector especially, it has been very difficult. So when the even pandemic, I remember it was around 18th of March here, we had one of the ladies who had basically come from Saudi Arabia after the pilgrimage, and she was given basically a clear route back home. She was not checked at airport because of whatever reason, I don't know. So after that she had some symptoms, and then she was finally COVID positive, and that was the first case. So 18th March we were in itself like just trying to find out what this disease is. We all had this thought process that it will not reach to Kashmir, as everyone thinks that yahan to nahi aayegi. But anyways, I think 19th March onwards, we had first, in fact, curfew kind of restrictions imposed well before rest of the country imposed. And then from 24th of March, it was very, very vigorous. So no doubt, like we all were caught unawares on this front, because after a long time we all had just started working. It was just 10-15 days that we were now trying to work and meet our needs, because financially we all were totally drained. It has been a worst time for all of us in the last 3-4 years
Exactly.
especially. So it basically struck hard, and then the cases started multiplying. Now, coming first to the health sector, what I feel that since here also the society was caught unaware, so they were not able to basically decide what all they have to do. And unfortunately, I will tell you that the planning was not proper. I'll tell you one simple two examples. Say, for example, we had a COVID crisis, and we also had non-COVID emergency patients. So what was done was that we have skims in Bimina, we have then JLNM hospital in Ranavari. They were just at once declared as COVID hospitals. And even in Sora hospital, you got COVID patients. And then what happened was that non-COVID emergencies were not treated that way. Even the ambulance service, you had no ambulance service for non-COVID emergency patients. You know, you have heart attack, you have cancer patients, you have pregnancies. Even in pregnancies, we had, you must have seen in the last couple of
Yes.
months, we had a very, very bad experience what is happening. So there was no planning in place that time that say you have one or two main COVID hospitals and then you also have non-COVID hospitals. Now see, what they have done is all doctors who are not dealing with the COVID emergencies, people from the medicine side or the pulmonary medicine side, what is happening is that they come once in 14 days. So what are you doing? You have totally kind of stopped that uh, particular departments by doing any activity. So people are not able to go. Now slowly OPDs have opened but not exactly in a full swing. Still surgeries are not happening that way. Doctors are trying their best to postpone. And the major problem for that is because you have got COVID patients almost in every hospital. Second, private healthcare has not grown much here. And that is why what we could have done that time was that we could have taken private hospitals and set up them as COVID hospitals with the staff, or at least out of government hospital, you could have selected one or two main hospitals which could have served as COVID hospitals, so that these non-COVID emergencies, these non-COVID issues, we could have taken care of. And what we have done in this is that one chunk of the staff is not at all working once in 14 days, and another is working day and night. And when they are on the front, so you are going to lose that manpower also, because many doctors are catching infection and then they have to go into quarantine, and then you're losing those super specialists as well. So we should have had plan A and plan B, wherein you could basically mix both, so that we could not have, like, I remember, because we run an ambulance service here in 7
Yes,
districts.
yes, I have read about you.
Yeah. And I have seen how many calls we receive from non-COVID emergency patients. You know, someone has having a cardiac arrest at times, someone is having pregnancy, and the guidelines have been a bit tough. You know, unfortunately, sometimes you receive a serious patient and you are telling him to first get a COVID certificate, you know, that you are COVID negative. That is a very big crisis. You know, if a person is in an emergency and that time you tell him to get a COVID negative certificate that very moment, it's going to take time and we will lose their life. So there had to be certain things. And in the first phase, which was a mistake I think has also been across the country,
Mhm.
we never formed an advisory board of doctors. Because see, bureaucracy is fine, I have
Yes, yes,
respect for all those planners, but you have to have a doctors board who would have basically organized in every state what is to be done. Now in
exactly.
J&K they did it just 2 weeks back, and now there is a doctor panel headed by one of our senior doctors, Dr. Khuru, who is basically giving them the plans and plan of action. And you could see slowly things are slightly moving better, because whatever said and done, we are there in that field and we could give better suggestions than someone who comes from the administrative side.
Exactly.
Because when they plan things, unfortunately, they, it's not that they deliberately do, but since they are not in clinical side, they miss certain things. And that is where the problems arise, and those small things finally result in loss of life.
So yeah, to sum up two main points you have specified, like non-COVID patients had suffered majorly because of this sudden attack or sudden spread of COVID, and as you said later, while the national board advisory board has formed, we should have included more from the doctors. And yes, sir, is that your pointing? Yes, sir.
Yeah, like these 2 points are very important, because what happened that we have not been able to differentiate finally the COVID and the non-COVID patients, and we have missed a lot in that sector. That has also resulted in panics. You know, if a person is now having slight chest pain or someone is having a bit throat problem, even if it is normal, so either they are not taken care of or they are not able to go to doctors because clinics were not opened, private hospitals were not also functioning that way. So it added to that crisis. And third factor wherein I would also like to add is again the rural, you know, the rural setup we have in all across. it's very weak healthcare system. You know that the surveillance is very weak, testing is not there. You can't
compared
have
to,
that kind of
yeah,
testing done in these rural areas. And then poor medical setup, like the doctors are not available or the staff shortage is there. So all these things totally combined together have given us this challenge.
all right, all right. So, sir, coming back to medical practicing in the Kashmir Valley, as a doctor working in Kashmir, or medical practitioner in Kashmir, how do you see your works going, or how do you see the life of a doctor in Kashmir? And one more thing to add on to my question, sir, how can we inspire more youth in Kashmir to get involved to professions like being a doctor or involving in medical fields? What are your suggestions on that?
See, I'll tell you, like, see, life of a medical doctor is also a bit tough, as the life of every human here in our place is, because day-to-day life is not that easy.
Exactly.
The major challenge, I think, even in COVID, that we all faced was the mental health of patients and mental health of doctors and paramedics as well. Because when you're already going through a crisis phase and then you see this as an another crisis, it's very difficult to balance the mental health and your own activity. So life is definitely tough, full of challenges. Now that in last 3 decades we all have been kind of, you can say, habitual of things. Sometimes we just don't concentrate on the negative part and we try to be more on a positive aspect. But overall there has been a lot of issues and a lot of problems in it. Now coming to, as far as the medical profession is concerned, I think one good thing in Kashmir is that education has always been one of the priority sector for parents as well as for the students here. And I should say that it's our honor that it's almost same as far as boys as well as girls are concerned. So normally right from start, you can say, especially I have seen in last 2 decades also, that even before that, Kashmiris always try to go for medicine or medical field or medical profession. In fact, we always have been debating that all the Kashmiris should not go for medical profession, and in fact, they should diversify into crafts, into engineering, into arts, into other field, because every second person would go for an entrance exam for medicine, and if they are not able to qualify here, then all India, then Bangladesh, then into CIS countries, Central Asia, even all other places, they have been going, and a huge number of students have been going there. But more than that, I would say that it is very, very important, considering even you must have seen this pandemic. After we do 10 plus 2, not only here, I am saying all across, that after 10 plus 2, we should have a mandatory 3 months training for everyone in hospital. Because those 3 months you should learn baseline, how to be with the patient, how to deal with the patient, what are the problems that you can handle at home, some baseline trainings. So this 3 to 4 month training will basically, one, give us a lot of human resource. Right now what we're talking about is that awareness is not there, or we just need healthcare workers, or we just need people. They are normal healthcare workers who just need to have basic knowledge. But if you're able to create this huge resource pool after 10 plus 2, you should always have students going into a hospital, working there for 3 months or 4 months time. And that will add to what we can have, like, in these crisis times, the major problem that we all face is manpower and resource. Rest you can manage, other things, but manpower and resource you can't manage in a very short span, that too in medicine when you're dealing with a human life.
Exactly.
So I think rest, obviously, our students are definitely going into various things. They have been into administrative services, they are going into engineering things, they are doing very good all across the world, I think. And I personally feel that the Kashmiri youngsters are very bright. Even youngsters from Jammu, they are also doing very good. So together, both the regions, as far as the literacy and other things is concerned, obviously we don't match Kerala, but we are also doing still better than rest of the
Exactly.
places.
And sir, I have read about you that you have actively engaged in social activism. Earlier, you only mentioned that you're running a free, I think it's a free ambulance service, sir. And you're also engaged to these entrepreneurship developments, reviving art, culture, heritage, etc. So as a social activist, or as a person who involves in social activism in Kashmir, what words do you have to say about the future, or what all suggestions can you give for a prosperous Kashmir without any conflicts or much better place to live on?
See, first coming to our, like, we run a trust, it's named as Wanchoo Trust, and this is an ambulance project wherein it is free for people who are below poverty line,
All
and
right.
rest we charge them on the fuel basis, because otherwise unfortunately people do call and you do misuse at times, so we have to
Yes.
keep that thing in mind. And second thing is, like, on different fronts we have been working, whether it has been on the tourism or entrepreneurship and other fronts. I would like to say, like, first and the foremost thing that we need here is that you have to share the pain, because I think that we all living here almost on a daily basis have seen a lot of pain, and you know that it is so difficult to balance that pain, and pain is always conquered by love. And that is one thing which I feel is that sharing the pain is very, very important, and you have to identify that pain, share that pain, and you have to combat that pain with love. That is what I feel first thing is very important, because our youngsters, our adults, our children, they are struggling a lot in day to day life. And last 3 decades, I think now we all are also, there's a threshold when you also get a kind of totally filled up, like we
Saturation.
we have, yeah, we have reached that saturation point. Then coming to the system, I think one very important thing that I have seen here is that you have to identify the right talent. We have wonderful bright children, boys and girls, both in Kashmir as well as in Jammu. But corruption, favoritism, and nepotism in our place has always been favoring those people who don't deserve to be at those positions. So you have incompetent people heading so many places, and competent people have nothing else but to go out of the state and see job opportunities there. So when you don't have the right intellect and the right brain within your state, you can't expect improvisation in different places.
Exactly.
Second thing is that we have made all institutions dead in last 3 decades. All educational institutions, all policy building institutions, because again, it has been filled up by people who are either believing in favoritism or corruption. And any person who's a normal person would not like to go into that, because if you have talent, if you have the merit, why don't I get that? Why I have to pay for even being in a meritorious setup? I think lots of our students who have been doing good in any particular field, whether it is even applying for a job, government jobs, semi autonomous bodies, other places, there has been a lot of this nexus of nepotism and favoritism and corruption of people who are at the helm of affairs. I won't say all, but there is a good chunk of those people who don't let good people come forward. So when you have totally finished your institutions, you are not getting a good brain to run those institutions, you would expect things to come forward. Like, it's a kind of that bureaucratic culture that has been established in so last 3 decades, that a normal person has no access. A normal person, now you can't fight on every front, we are already facing lots of troubles in last 3 decades day to day, then you have to just have your living. So you finally surrender and you plan to go maybe out of J&K somewhere, do a job in some private corporation and then run. So I think it's very important to first do these two things and then connect right kind of people. There has been no platform in both, even in Jammu or in Kashmir, wherein we could have these bright minds nurtured every 3 years, every 5 years, people who can basically change this place, people who can contribute in a bigger way. I will tell you that industrialists who start things here, they have faced a lot of challenge and trouble. People who
Right.
came all the way out from, say, abroad or other places to Jammu or to Kashmir. For business houses, running things have been so difficult. So you can't generate employment, you can't have a sustainable business culture. Then how can you deliver? So I think these are some basic things that have never been here in last 3 decades. So leave aside other things, because resolutions are obviously at a very high level. They are all the big people who basically talk with each other and do. I'm saying normal basic things for a normal human being are so difficult here. If you have to do a simple, someone has, like, we have so many illegal constructions here which have happened in Srinagar, in all other places during all these decades because of the corruption and knowing someone. And a normal person, if he just raises a voice, there is no one to listen to him. Either he is crushed by one mean or the other mean. And then if there is nothing else, they will tell this is security concern, and that's it. So no one even gets up to fight. So basic things that every human being needs, we should have that. And above all, as I told you, sharing the pain, because Kashmir has gone through a lot of pain. There is no family which has not lost a family member. So obviously when you are in that kind of depression, that kind of uh, you know hurt is within your mind, you cannot expect any good thing from that person. The
Yeah.
first thing that is required is to share that pain.
So share that pain. That's a great slogan, actually. So with that note, Dr. Amit sir, thank you for sharing your valuable time with me, and thank you for joining me for this very quick session and sharing your valuable ideas, views on all these aspects. Once again, happy Doctor's Day to you, sir. I wish you very all best wishes, and let's all work together to build a much prosperous Kashmir. Thank you, sir.
Thank you so much, Irfan. And again, thanks to you and everyone there. Happy Doctor's Day to everyone. And let us hope that we all work for humanity and at least give every individual their right to live. Live happily, live gracefully, live nicely. Thank you so much.